brachial plexus is the plexus of nerves which supply the upper limb. It arises in the neck and passes through the cervicoaxillary canal into the axilla. In the neck, it is formed from the ventral rami of C5 to T1 spinal nerves. So you can see the C5, C6, C7, C8 and T1 spinal nerves here. These are called the roots of the brachial plexus. Sometimes C4 nerve can involve in the formation of brachial plexus, then it is called prefixed plexus. And if the T2 joins with the brachial plexus, it is called postfixed plexus. So next step in the formation of brachial plexus is the formation of trunks. You can see the upper two will unite to form the upper trunk. C5 and C6 unite to form the upper trunk. The C7 continues as the middle trunk, and C7 and C8 and T1 spinal nerves join to form the lower trunk. All of them are seen at the root of the neck, just above the clavicle. Here you have to know two important relations of the brachial plexus. One is the subclavian artery. You can see that the trunks of the brachial plexus are seen just above the subclavian artery. So this is the subclavian artery and this is the axillary arteries. First part, third part, and here here will be the second part of the artery. In the infraclavicular part, the brachial plexus are seen in relation to the axillary artery. They are seen around the axillary artery, whereas in the neck, their trunks are above the subclavian artery. These are the two muscles seen in immediate relation to the brachial plexus. Actually, the brachial plexus emerge between these two muscles. The one anterior is the scalenus anterior muscle and the posterior one is called the scalenus medius muscle. Now let us see about the divisions of the brachial plexus. That is the next step in the formation. Just behind the clavicle, that is when it is in the cervicoaxillary canal, each trunk divides into anterior and posterior divisions. The anterior divisions will supply the anterior aspect of the upper limb, whereas the posterior divisions will supply the posterior aspect of the upper limb. The posterior divisions of the three trunks will unite to form the cords. That is the next step in the formation of brachial plexus, formation of cords. You can see the posterior cord formed from the posterior division of upper, middle and lower trunks. You can see the posterior cord is at first lateral to the axillary artery, to the first part of axillary artery, whereas it then becomes posterior to the second part of the axillary artery. The anterior division of the lower trunk continues downwards as the medial cord of brachial plexus. And you can see medial cord is at first posterior to the first part of axillary artery and then it becomes medial to the second part of the artery. The anterior divisions of upper and middle trunks will unite to form the lateral cord, which is lateral to the first part and second part of the artery, axillary artery. Now we should see the branches of the brachial plexus. The third part of the axillary artery is related to the branches only. Cords extend up to the second part and they are named according to their position in relation to the second part of the axillary artery. Medial cord is medial to the second part, posterior cord is posterior to the second part and the lateral cord is lateral to the second part. First, we will see the branches from the root of the brachial plexus. See here, a nerve is formed from the C5, C6 and C7 roots of the brachial plexus. It goes through the cervicoaxillary canal and is plastered to the medial wall of the axilla just over the serratus anterior muscle. This is the long thoracic nerve. There is another branch from the root of the brachial plexus, that is from the C5. You can see a nerve going backwards to the dorsal surface of the thoracic wall and it is medial to the scapula and supplies the muscles which connect the medial border of the scapula to the vertebral column. That is known as dorsal scapular nerve. there are some other branches from the roots that supply the muscles in the neck, and also it will C5 will give a tweak to the formation of phrenic nerve. Now we will see the branches from the trunks. Only upper trunk gives off branches. And you can see the branch from the upper trunk goes to the superior aspect of the scapula and is seen in the suprascapular notch. So it is called suprascapular nerve. It will go to the posterior aspect of the scapula and will supply the muscles which arises from the posterior surface of the scapula, that is supraspinatus and infraspinatus muscle. Now branches from the upper trunk, another branch from the upper trunk is now to subclavius muscle. You can see it going anteriorly to the middle and lower trunk of the brachial plexus and just in front of the subclavian artery to reach the inferior surface of the clavicle, behind the clavicle, and it will supply the subclavius muscle. So these are the two branches from the upper trunk. No other branches arise from the trunks of the brachial plexus. Now we will see the branches from the cords of the brachial plexus. First one, you can see there is a branch arising from the medial cord of the brachial plexus near the first part of the axillary artery. This is the medial pectoral nerve. Like that, and branch arises from the lateral cord also in relation to the first part of the axillary artery and goes to the pectoral region, that is the lateral pectoral nerve. Now, the cords give branches. The other branches of the cords are around the third part of the axillary artery. You can see the lateral cord giving a lateral branch here. This is called the musculocutaneous nerve, and this musculocutaneous nerve supplies the flexors of the elbow joint. The remaining part of the lateral cord, that is after giving of lateral pectoral nerve and musculocutaneous nerve, will receive a tweak from the medial cord which will cross in front of the axillary artery, third part of the axillary artery. These two unite to form a single nerve called median nerve. So this is the lateral root of median nerve and this is the medial root of median nerve. Now the branches of the lateral cord are lateral pectoral nerve, musculocutaneous nerve and lateral root of median nerve. Now we have seen two branches from the medial cord, that is the medial pectoral nerve and the medial root of median nerve. The remaining part of the medial cord will divide into three. And you can see one of the branch is medial to the axillary vein, that is the medial cutaneous nerve of arm, and two branches are seen between axillary artery and vein. One of them is superficial and it's known as medial cutaneous nerve of forearm, and the deeper one is the ulnar nerve. So these two are cutaneous nerves, whereas ulnar nerve is a mixed nerve which will supply the flexors of the wrist joint in the forearm. Now we will see the branches of the posterior cord. You can see the posterior cord here, and it will give off two branches into the subscapular fossa and the muscle within it, that is the subscapularis muscle. So they are called upper and lower subscapular nerves. One of the nerves arises in between these two branches and goes downwards to supply the latissimus dorsae muscle, that is called thoracodorsal nerve. Now you see the upper and lower subscapular nerves are named according to their positions in relation to the thoracodorsal nerve. The remaining part of the posterior cord gives off a branch which winds around the surgical neck of the humerus to go to the posterior aspect, that is known as axillary nerve or circumflex nerve. And then the posterior cord continues downwards as the radial nerve. So the branches of the posterior cord are upper and lower subscapular nerve, thoracodorsal nerve, axillary nerve and radial nerve. Now let us see a simple diagram which you can reproduce. So these are the roots of the brachial plexus, and then you can draw the upper, middle and lower trunks like this. C5 and C6 forming the upper trunk, C7 continuing as middle trunk, C8 and T1 forming the lower trunk. Then you can draw the posterior divisions of the three trunks to and draw the posterior cord of the brachial plexus. Then draw the anterior division of the lower trunk to represent the medial cord, and unite the anterior divisions of the upper and middle trunk to form the lateral cord, like this. Imagine the axillary artery will be here and posterior cord posterior to it, medial cord medial to it, and lateral cord lateral to it. Now let us draw the branches. First you can draw the long thoracic nerve. See, 3 twigs rising from 5, 6 and 7. This is the long thoracic nerve. And draw the dorsal scapular nerve from the C5 itself. Then from the trunks, draw the suprascapular nerve backwards and nerve to subclavius anteriorly. Now branches from the cords. First you draw the medial pectoral nerve from the medial cord and lateral pectoral nerve from the lateral cord just after their formation. Then draw the musculocutaneous nerve and then draw a twig that will join with the lateral cord from the medial cord, thus forming the median nerve. This is the lateral root and this is the medial root of median nerve. Then divide the rest of the medial cord into 3, the continuation forming ulnar nerve, and medial most is medial cutaneous nerve of arm, then the medial cutaneous nerve of forearm and the ulnar nerve. Then draw the branches of the posterior cord, 2 short ones, upper and lower subscapular, and a longer one thoracodorsal, and 2 terminal divisions, axillary and radial nerve. See that the posterior cord continues as the radial nerve. So this is a simple diagram which you can reproduce. Now let us see what is meant by root value. Root value of a spinal nerve means the number of spinal nerves which contributes to its formation. So we can see the dorsal scapular nerve arising from the C5, so its root value will be C5. And long thoracic nerve arising from C5, 6 and 7, so its root value will be C5, 6 and 7. Suprascapular nerve and nerve to subclavius arise from the upper trunk, which in turn is formed from C5 and C6, so their root value will be C5 and C6. Like that, lateral pectoral nerve and musculocutaneous nerve arises from the lateral cord, which is formed from C7, C6 and C5. So their root value will be C5, 6 and 7. Whereas the median nerve, you can see it receives a twig from the lateral and the medial cord. So all the 5 spinal nerves will contribute to its formation. So its root value will be C5, C6, C6, 7, 8 and T1. Now about the medial cord, medial pectoral nerve, medial cutaneous nerve of arm and medial cutaneous nerve of forearm all arise from the medial cord, which arises from the C8 and T1. So their root value will be C8 and T1. Whereas ulnar nerve receives a twig from the lateral cord of the brachial plexus, lateral root of median nerve, which carries C7 fibers to it. So it will have an additional C7 apart from C8 and T1 of the medial cord. Now you see the upper and lower subscapular nerves are supplying only the shoulder region, to the subscapularis and teres major muscle in the shoulder region. So they will have only 5 and 6 spinal nerves in it. So their root value will be C5 and 6, even though they are branches of posterior cord which has all the 5 spinal components. The thoracodorsal nerve goes downwards to supply the latissimus dorsi. So its root value will be 6, 7 and 8, just below 5. It will begin at 6, 7 and then 8. You see the axillary nerve also supplies only the shoulder region, so its root value will be C6, C5 and 6. Radial nerve in turn supplies extensors of elbow joint as well as wrist joint. It will go up to the tip of the fingers. So it will have all the spinal nerves within it, C5 to T1. Now you see the median nerve has all the spinal nerves, radial nerve has all the spinal nerves, and they will supply the arm, forearm up to the tip of the fingers. Ulnar nerve also has C8 and T1. The C8 and T1 will supply the palm, hand. Okay, so all the nerves which reach up to the palm hand will have C8 and T1 in them. Okay, that's about the root value.